In 2019, about 21 million Americans grappled with addiction. Between April 2020 and April 2021, more than 101,000 Americans died from a fatal overdose. This number marks an increase of almost 30% from the previous year, according to the Centers for Disease Control and Prevention. It's a staggering number that only further highlights the worsening drug crisis that's plaguing this country. And addiction can happen to anyone. Oftentimes, it's an invisible struggle that doesn't come to light until a breaking point is reached. For Dr. Erik Fisher, he developed a strong addiction to alcohol and stimulants while in medical school and residency. For years, he was a highly functioning addict who concealed his substance abuse and justified his use through different rationalizations.
I was really struggling with addiction toward the end of medical school and in the earlier part of my psychiatric training. And people mean different things by the word rationalization. For me, rationalization in that case meant constructing a narrative about myself as successful, as achieving, as put together, as winning awards at medical school and writing scholarly papers. And to me, that was part of my justification for continuing really harmful alcohol and stimulant use. And one of the elements that really misled me, I think, was this sort of us-them distinction with addiction, that I thought that addiction was something extreme, and both my parents struggled with addiction, and I thought I'm not like them. And that fed into my sort of justification and rationalization of my problem.
Despite the successful external appearance Fisher had created, his internal life was crumbling. There were multiple moments when he realized he may have a problem, yet he didn't get help until one day everything came crashing down.
But the actual breaking point was when I reached an absolute unavoidable crisis, and I did so much alcohol and stimulants that I got manic and psychotic, and I wound up in the psychiatric ward at Bellevue Hospital. And at that point, it was pretty unavoidable. I had to get treatment. And it was really like my reality had fractured, and this idea of myself that I had constructed had to be totally broken down and reassembled.
Today, Fisher is a recovering addict. He's also a psychiatrist and an assistant professor of clinical psychiatry at Columbia University. He's also the author of the book, The Urge: Our History of Addiction. He says that there are many factors that feed into why addiction happens.
Addiction is really intertwined with identity. It's not just an issue of it being taken over by a substance. For me, at least, in many of the examples I've seen over the history, addiction also has to do deeply with how we think of ourselves and how we relate to our suffering and how do we make sense of the suffering of the world.
But why does addiction happen? Are some people more predisposed to addiction than others?
There are real contributions of genetics, and there are ways that genetics are sometimes oversold and misunderstood. In certain circles, there's this tendency to be very deterministic about science. And I think the best scientists out there are able to hold multiple levels in mind at the same time, where addiction is a physical phenomenon, and it's also a human phenomenon, and it's a societal phenomenon, an economic phenomenon. But sometimes in sound bites and in the public communications around addiction, not to mention outright profiteering by, say, for example, for-profit treatment centers, we get sold a notion of addiction as fatalistic, as determined by our genetics. And there are actually many examples of that, not just in recent years, but stretching all the way back to, say, the 19th century, where people were hawking miracle cures for addiction. So it's important to recognize that there is a really powerful physical contribution to addiction, while also respecting that's not the whole story.
From environment stress to social factors, there are many elements that feed into substance abuse. Especially over the last 2 years, the pandemic has created a unique circumstance and added stress for millions.
The opiate overdose crisis has reached a new peak during the pandemic at 100,000 deaths per year, and that is only reflective of increased rates of alcohol use and other drug use as people grapple with loneliness and alienation and isolation and lack of opportunity to participate in meaningful work and all these other deeper social problems that go into feeding addiction.
And people have grappled with addiction in different ways across the centuries. Fisher said the formal word addiction only came about around 100 years ago.
There was actually a brief window of really holistic, compassionate care, but then that was overshadowed by a series of racial panics. And black cocaine use was really villainized because of racist fears, and then because of xenophobic fears and panics about Chinese immigration, opium was associated with the quote-unquote wrong kinds of users in the West, and there were panics about heroin, and all of these things combined to make drug use, and particularly the kinds of so-called wrong drugs or bad drugs, were villainized around that time 100 years ago. I don't know that we had a unified notion of people with addiction 100 years ago. There were the sort of wrong sorts of users over here. There were people that were the victims of racial panics and moral panics. And then there were also people who were using drugs like morphine in white markets and upscale markets who were actually also suffering because their real and legitimate problems were overlooked by this sort of myopic view of what good use was and what bad use was.
Even today, not everyone suffering from substance abuse disorders is treated the same. Some receive compassionate, comprehensive care, while others get little to no help. Fisher says that after his hospitalization, he took an introspective view into how his treatment may have differed if he looked a different way or lived in a worse neighborhood.
I'm a big guy. I'm 6'3", and imagine if I were floridly manic and psychotic, but I was black and I was in Harlem. Maybe I would have been lucky and gone to the hospital, but it's very likely I would have had a totally different experience.
Fisher recounts being in treatment and seeing the division in care between patients. He says this uneven distribution in resources and help not only harms those seeking treatment, but ultimately everyone in society.
There's no such thing as oppressing one group of people with addiction without it coming back to harm all of us. And the way that drug use and that addiction was portrayed, especially through a very charged and racist set of lenses through the worst years of the sort of war on drugs, say no to drugs crackdowns in the 1980s and 1990s, all of those factors really undermined our attempts at compassionate treatment, and still are there today.
Offering an effective treatment plan that can include a combination of behavioral treatment and medication, or either or, is a vital step to getting people on the right path. There's no doubt that addiction has turned into a national crisis, and one that will only grow worse if not dealt with. For instance, the influx of the highly potent opioid fentanyl has led to a more dangerous high for addicts seeking a fix.
People, especially people with addiction, will turn to other formulations of drugs. You can't stamp out drug use with prohibition alone. And so as we crack down on the opioid epidemic by restricting opioid prescriptions, deaths didn't go down. A big part of why they didn't go down is people will just turn to other formulations, to turn to street heroin in the first place, and then later, now we have a wave of fentanyl, which is effectively poisoning. It's just so potent and so unpredictable that the supply for people who use drugs is so unsafe that it's just really, really dangerous.
Addiction is not black and white. It's a different experience for everyone. There is no shame in asking for help if you need it. If you or someone you know is struggling with addiction, find help and resources by calling the National Substance Abuse Hotline at 1-800-662-4357. The helpline is free, confidential, and open 24/7. To find out more about our guest, Dr. Carl Erik Fisher, visit viewpointsradio.org. Also check out his book, The Urge, Our History of Addiction, available online and in bookstores. This segment was written and produced by Amira Zaveri. I'm Gary Price. Coming up on Viewpoints.
If you only ever read about a violin and had never heard one played, do you have an adequate education in violin?
Finding more opportunities for active learning rather than passive. Then,
But had not been for Watergate, the horrible mistake he made with Watergate, he would be considered one of our better presidents for what he did with the environment.
We explore the lasting legacies of former presidents. I'm Marty Peterson.
and I'm Gary Price. These stories in depth, week on your public affairs magazine, Viewpoints.
And that's Viewpoints for this week. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows and find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints.